I am Emma, and I am the Human Services Administrative Specialist, and I am here with Michele. So, Michele, can you tell me a little bit about what you do?
Thanks so much for having us. My name is Michele Gurtler. I'm a licensed mental health counselor, and I'm the clinic director for the Central Washington University Community Counseling Clinic. So, yes, we're located in the psychology building on campus on the first floor in Suite 118.
Awesome. What made you get into that work?
I've seen kids and families through the course of my counseling career for, it's 33 years this year. So I've been seeing kids and families from mental health throughout the years, and I don't know how I got into that. I just don't even know, thinking back. I also have a school counselor certification, so I didn't do that. I got into mental health instead.
Okay, very cool. What is the primary population that you're serving?
Sure. We see when the clinic first opened, it was been just about a year. Our priority population was 12 to 17-year-olds. So we've expanded that now to 7 and 17. And if there was a 6-year-old that needed services and was without, we would, entertain that as a referral as well. And if somebody is in counseling at 17 and let's say they have a birthday that turns them 18, we don't say you're done and they leave. We finish until their treatment, goals have been reached as far as they want to be. So you wouldn't, just because turning 18, you would be out. So 7 to 17 is our priority population, and it's kids and families that live here in Kittitas County.
That's really cool. Yeah, I can imagine that would be, it would be hard if they hadn't reached their goals yet.
Yes.
They might be worried about what's going to happen next.
Yes.
I'm sure it's important to have that consistency with your counselor. Are most of your patients with the same counselor throughout the entire time?
Yep, that's what we've been as a priority try to do. We've had the graduate students in the school psychology program. They're a second year. It's right before they go and do their year-long internship out in schools as a school psychologist. So they saw clients through the winter and spring quarters. So what is that? January through May, June. And they all had the same therapist. So they were supervised by myself and then another licensed clinician who ran the practicum for them. And they all had one client apiece. And so they kept them for that 6 months.
Awesome.
And if somebody once the students graduated, if they hadn't finished their treatment goals, if they still wanted to see someone, then they transferred to me. And so some of them have kept on until they reached their treatment goals.
Awesome. How many kids have you been able to help over this past year?
So we have had, I brought the numbers because it's a huge amount of numbers. We have had 334 referrals come through from last September to today.
That's awesome.
Yes. And so that's, we get referrals lots of different ways. We get them through the Handle with Care with Ellensburg Police Department, through school districts, school counselors, parents. Kids 13 and older can refer themselves in the state of Washington. They can have mental health services at the age of 13 and sign all their own paperwork. We have through juvenile probation, lots of different places a referral can come from.
Okay, so if a parent noticed that their child was struggling at school or at home, would they be able to just call you guys to get support?
Absolutely. We provided the referral forms to all the school counselors, so they can give them out. They can call and make a referral. If a parent wants to just call and ask questions, they can call, and so they feel more comfortable. That was one of the things we're trying to increase access for people. And then because services are free, because it's covered with the 1/10 of 1% funding, which is it's an amazing, amazing thing that people can come for mental health services for free and have them. And so we've just tried to increase access so that everybody at least has the opportunity. Now, 334 referrals, not everybody comes into services, but at least we call, we send a letter if they don't call us back. We reach out to them so that they know that there is this service within the community. And then it leaves it in their lap. Do you want to come? Do you not want to come? We describe the services, how we can help, what we can talk about. Trying to reduce stigma of mental health. Everybody's worried about what people will think, what somebody will say about them, how that works. And so I've met people in a park, or I've met people at one of the eateries at Ellensburg, because that's where they felt comfortable, just to kind of describe, this is how we can help. This is the worry that you might have. How can we reduce some of that stigma coming to mental health.
Right. The stigma is huge. I mean, I have used therapy as a tool since I was very young. And I know that a lot of people are not comfortable giving those services or don't want people to know that they're accessing those services. But yeah, that's huge to be able to reduce that stigma so that people can get the help they need.
Absolutely. And if people still have questions like, well, we're not quite sure, we just say, come and see the building, come and see the office, come in, let's just talk. We'll do a meet and greet and you can just come in and see that the office isn't, you don't have to lay on the couch. You can just come in and like, just ask questions and I'll answer whatever you want to know.
Yeah.
And so we're just trying to do that and reduce people's fear about asking for help. And at least they know that there's a support. If at any point, even some of those 334, they've been an ongoing referral. Maybe they've come through the Handle with Care program 2 or 3 times. We'll still call and still say, because we think maybe this time they might say like, well, maybe we should try something different.
Yeah.
And so we just make that available. And if they say no, we say, all right, we're here and you can always call back.
Great. And the Handle with Care program, that is where children who were involved in a traumatic event get referred to. That is correct?
Yes. Yep. They've had some kind of contact with the Ellensburg Police Department.
Okay.
And at that point, it's the referrals goes and it comes to me and Juanita and I, who's the secretary in the clinic, we worked together, her and I, for 12 years. And she's a bilingual, so she can help with anybody that comes in or that is monolingual Spanish or bilingual. And so she helps me with some of that. If we have a parent that wants to come in and talk about things or has questions. A lot of our material is in English and Spanish both. We have a lot of parent articles that we use and give out and provide. When we go to community events, we'll take some of those things as well. So people just have some general information. One of the articles we had out for school was like how to make the mornings go easier, how to set up homework time, how to talk to your teacher if there's problems going on. And just some really basic articles like here's just some ideas.
Yeah. And as a mom, I'm like, so much of that would just be helpful for anyone. I mean, if they're not like having those resources is so great.
Yeah.
Do you feel like when you are you seeing a theme throughout a lot of the children that you see that is a huge, I guess, when you're working with kids, are you seeing a pressing issue or a theme throughout that you guys are really prioritizing?
We have not necessarily prioritizing. Everybody comes in with whatever, they want to bring in. We have an intake that we do treatment goals and they can identify like, these are the things I want to work on. This is what I want my life to be better about. This is how we need help. But no, I think anxiety is something that's very prevalent that I think having bad relationship with food when you're adolescents, male and boys and girls is something that's very prevalent. Even suicidal ideation, right? And then having a safety plan and being able to ask about it and monitor that and assess for it. But just sometimes just needing a little extra help. Like here are some options.
Yeah. Overall, are you seeing when you're working with these patients one-on-one, do you get to see them grow since it's over an extended period of time and you get to see that out?
Yes, absolutely. We've had lots of kids that have come through and treatment has been completed. They've reached their treatment plan goals to their satisfaction and we discharge them. And even if we close them and something happens in a month, it's easy for them to get back in. We have very quick access. We just had a bunch of referrals come through the other day for Handle with Care. Juanita called and offered 3 intakes. I've got 3 intakes next week. We just got those this week, scheduled them for next week. So it's a quick turnaround. So if somebody does close, they're like, oh, I've reached everything. And in a month, something happens. It's easy to get them back in. There's no wait. We don't have a wait list. And because we're not particular about insurance or private pay or anything like that, we can get people in fairly quickly, which is nice. So that's in helping to increase some access.
Yeah, that's a huge barrier for a lot of people is just finding the care, getting on the wait list, insurance. There's so many different types of insurance or no insurance. Yes. I can see how that would be really, really helpful. It must be a really hard job sometimes emotionally. I could see you get to work with a lot of tough stuff.
Yes. The other end of it is that you can see the good stuff. Even if they come in with tough stuff, that they're getting on the other end of it. They have their young people, and so they have a lot of life left, and getting them to see that not everything will always be as it is in this moment, right? Let's get you through this tough moment because you have other things that you want to do. You want to graduate, you want to go to college, you want to have a job, you want to travel the world, you want to buy a car and drive to wherever you want to drive to.
Right. Looking ahead right now is just a moment.
Absolutely. And so trying to convince young people who have that they have access to so much stuff so quickly, you know, they on their phone and they have access to millions of pieces of information. And so getting them to look like, I can't solve it right this second, but in a little while it'll be solved. In a little while it'll be better. In a moment I will be okay and I'll feel better. So even though it's hard, you can see that other end of it. I want kids to know that at some point in their life, they've had somebody tell them, you can do whatever you want. You can go there. You can do that. Just to know that, and to have them have a good experience as a young person with a counselor or a therapist, however, whichever you want to call, that maybe they're not like so open to what you're telling them now, but maybe when they're 25 or 30, they'll look back and say, well, that lady wasn't so bad. Like, I'll try it again. Like, it did help a little bit, and so they won't have a terrible experience. And then in their older life, they can maybe go back to somebody because they had a good experience when they were younger.
That makes a lot of sense. And I feel like just having an adult who they know is going to listen to them and that they can trust, I'm sure that is huge, even if they're not, particularly open to the feedback right now. Just having somebody who's going to listen to me and wants to help.
And my approach is like, I'll give you the adult perspective. Like, this is how your parent will think about something like this. This is how they've said this. So how can you manage that? How can you go forward? Having trouble with friends, lots of teenagers have trouble, lots of drama, lots of things going on, and being able to be like, okay, how can you stay out of that's a lot of energy to use. Where else can you use your energy instead? For the benefit of you. So, and then helping parents be able to navigate when their kids are struggling, feeling like they've done something wrong or it's our fault, and, being able to work through some of that together with them, and help. Like, okay, everybody can blame forever, but how can we move forward? What's some steps we can do to get you moving forward?
Great.
And to better the relationship with your child. So that's how I kind of look at it. That's the benefit of, I guess, doing it for so long. That's why I really enjoy the 7 to 17. I've seen adults, I've seen older, adults in services throughout the course of my career, but kids are, I don't know,
the future.
Yeah,
They
are. Absolutely.
Yeah. That's awesome. Is there anything that you would recommend for a parent who started having some concerns about their child's mental health, but maybe they haven't taken that next step into seeking support? What would you recommend for them?
You can use lots of natural supports. So there's always school counselors. Lots of doctors' offices now have behavioral health consultants within medical clinics. And so they're kind of more short term, and you can talk with them and be like, okay, these are some of the struggles. Is this within developmental norms? Is it above? Is it not? Am I worrying too much? They can call the clinic. They can talk to their own primary care physician. I guess everybody Googles everything anymore. You could Google something, but then I don't know. I think that's hard to get the answers that you might want. So probably school counselors, the behavioral health consultants, your primary care physician, the other mental health providers here in the community, calling and talking with people on the phone. Of course, if they're afraid of their child hurting themselves or somebody else, taking them to the emergency department, calling the 988 and being attached and getting hooked up with somebody that can help you in an urgent situation, calling 911, asking for help.
If you had advice for somebody who is having a hard time struggling right now, what would that be?
Go to a trusted adult and ask for help. Go to somebody that you trust, that can help you. That could be a teacher, it could be a coach, it could be a parent, it could be an aunt, it could be your neighbor that you really get along with, that you spend time with, a school counselor. and go and say, I'm struggling with this and I need help.
What if they are feeling embarrassed or they're feeling that stigma? What are some ways they could help work through that barrier?
I think probably for teenagers, because it is sometimes hard to ask for help, just knowing that there are people that care about you, that love you, that would help you no matter what you asked, and just feeling like that you have to kind of trust that.
Yeah.
That there are adults out there that are willing to help, and being able to go to them and feel like you can do that.
It can be isolating when you're having a hard time. So just knowing you're not alone.
Yes, calling the even the 988, right? You don't have to see anybody. You could hang up. They aren't looking at you. And it would be kind of anonymous, you would think, but it would be a supportive person on the other end of the line that would try and help you.
Awesome.
And being, if they're already thinking that they're going to go to somebody or that they're having this trouble and they're even approaching talking with somebody, just getting over that next little barrier of really saying it. Lots of times kids reach out to each other, and then that friend sometimes will go to another adult for help as well. So just going out to somebody that you can trust, a trusted adult would be my best advice. And then secondary would be a friend that's then going to get you some help too.
Right. Yeah, that makes sense. What way do you think that your program specifically is benefiting the youth of Kittitas County?
I think because we have really good access, trying to create access for kids in Kittitas County and their families, having the services be free. And then also the commitment by Central, having it in a building on campus and having it open. We have designated parking spots, parking is a premium on at campus. And then just knowing that we also, it's a training, facility as well. For the second year, we're having the Masters in Mental Health Counseling program that's going to be starting this fall. And then we'll be training counselors that will go out into the field. We have the school psychologists that are out now in school districts and being a school psychologist and doing testing and interacting with students. And so by creating access, free services, and then also training the counselors of tomorrow.
Okay, that's right. Yeah, that's really cool. It not only helps our youth that are needing the tools now,
yes,
but bringing more professionals to have a wider reach.
Absolutely.
When they graduate. So if people want to learn more about what you guys are doing or want to get in contact, what's the best way to get your guys' information?
The best way would probably be just a call.
Okay.
It would be 509-963-2501 is the office phone number, and just call and ask. Juanita's answers and can answer lots of questions. If not, she transfers them to me. I can answer questions. And so whatever's easiest and reduces any barriers to getting people in, or at least thinking about coming in and getting some extra help and support.
Do you guys have a website as well that they can look at?
Yes, it's through the Central Washington University website under the psychology department. I believe is where they could find that. If not, just calling is just as easy.
Okay, perfect. Yeah, and we can link that in the description.
Wonderful.
Thank you, Michele, for giving us all of this awesome information and for sitting down with me today. And thank you guys for watching. I hope that you got as much valuable information as I did.